response to COVID-19.
No, thank you, sir. And yes, so testing continues. We did lose a few days last week, and I'll talk about that in a second. But this week, again, have about 10 sites up in Newcastle County. No doctor's orders needed. You can make an appointment or show up. Or, I mean, good thing is we are not turning people away, during these events. We've been able to accommodate just about everybody that's shown up really since the beginning. So capacity is good. You can go to de.gov/gettested to find out locations and times that are convenient for you. Kent and Sussex, same URL. You can go to the checkout, and we got 4 events this week there. Very successful day yesterday in Dover, and I think, we're kind of in routine. People know where we're going to be there, and getting some good numbers, weather depending. And that leads me into the next thing. So we did see a decline the last 2 weeks. We lost about 3,000. We didn't lose. We're down about 3,000 individuals last week that got tested. Testing events on Tuesday were canceled due to the tropical storm. Friday's events up in Newcastle happened to be evening events, and they were all closed early due to the severe weather that rolled through. So we have the capacity, we have the events. Unfortunately, we have to deal with the weather as it comes up and causes some issues, but we continue and march on. We're still rotating around to make sure we are able to, get to different communities and, get people tested. The Walgreens partnership's been working very well. Looking in the next few weeks to expand that, and Dr. Rattay will hopefully have some information on that in the next week or so. But again, that will give us just a little wider foundation that we go out there and help get out in the community. And then we continue to develop or to look at new options, and that takes us to the school and teacher testing. So as we announced last week, we are going to be rolling out teacher and staff. So anybody that works in schools that could be there while students are, including bus drivers, other staff, administrations, et cetera, will be tested, have the opportunity to be tested, and then we're going to do about a quarter of them a week ongoing. So, it's good for surveillance and make sure they're done once a month as well. So we have, again, expanded the type of testing. We're going to be using another saliva-based test, so it's very, easy for individuals to do, and it gives us additional lab capacity. So now we have what the public health lab could do, what we're doing through Curative, and now the vault being the third lab or the third component to that. So exciting to get that off the ground. We know that's been something the teachers and staff of schools have been concerned about, and hopefully that'll make it just that much more safer as we get students back in the classroom. So the second part of that, and something we're working on, and it's a little bit moving target, as Dr. Rattay mentioned, and the governor, the schools are presenting their plans right now to their boards to get approval for how they are going to go back. So we are going to greatly increase community testing over the next probably month. It's going to be focused around the school district. So we are going to try and have several days of testing in school districts, depending on the size of the school district, about a week prior to students getting back into the class. However, right now, this is kind of in flux, as we know some school districts are deciding what model they're going with and what date they are going to be going back. So as we get those confirmed through our partners at Department of Education and the districts, we'll be rolling out the schedule. And I want to make sure it's clear that if you are in, Colonial School District, but you happen to be somewhere else the day they're testing there, we don't care where you take your kids to get tested. They could go to any one of these sites. They're going to be open for the community as well, but we are going to be, probably doing 2 to 3 times the amount of testing for several weeks there. So it's going to be a heavy logistical lift, but we're going to be all over the state concentrating on high schools just because they have the footprint to accommodate the drive-through and walk-up individuals. So more to that as we confirm that. Probably had the first 2 weeks planned out by the end of this week, early next week, and we'll share that with you, and also communicate through the school districts so parents see it as they get their kids ready to go back to school. Governor?
Yeah, so AJ, great work. Thank you for your attention. I think it was 3 or 4 weeks ago, I said to you at one of our meetings, I want to test every teacher and every member of the school staffs across our state as they reopen schools, and you've got a really good plan to do just exactly that. It's a plan that I think will be easy for teachers and staff to make sure that they get tested, since they can basically do it themselves. at home and register with the testing company. We'll have those results in advance of their coming back into buildings, and then we'll test them regularly after that, and continue to focus on making sure that the schools are safe places for teachers, staff, and children. And we think that we can do it. The key is in continuing to win this battle with COVID-19, to flatten the curve, to crush the virus, as I say, is for everybody to help out by wearing a mask, by practicing social distancing, by following the restrictions. And if we do that, we can get our children back in schools. We can get back more to a normal way of doing business in our state. We can open businesses more fully, and we can strengthen our economy and get people back to work. So we're all in this together, and we're going to win this battle together. So with that, again, we thank the media for covering our press conference today so we can talk to our constituents and the people that we work for, the people of Delaware, and answer any questions that you have. Meredith, thanks for being with us again.
Hello. Just to start off, a clarifying question about testing within school staff. Is it required for staff members and teachers to get tested? I just saw has the opportunity.
Yes, so from the state's perspective in public health, they can't make them, so that's going to be something that's up to the school districts. So it's highly encouraged, we'll put it that way.
Oh, okay. So I'm just curious. Again, I know previous comparisons with nursing homes, apples and oranges, but I am curious why the state would recommend nursing home staff but not teachers at this point.
So I believe there's a licensing component to that too. I'm not sure if Dr. Rattay wants to add anything more, but I think it's just, the school districts are the ones that employ the teachers.
And just to follow up on that, does the state plan to publicly track any infections if and when there's confirmed cases in schools?
Yeah, so we absolutely will be tracking, any infections that might occur in the school setting. It's a part of our case investigation work now. For every case, it's one of the questions that is asked. Schools would be considered one of the high-risk settings, and so whether it's the school that might find out first that there's a positive case or public health, we will work very, very closely with the schools, with the school district in responding. There may be times when there's really no need for the public to know. For example, if a person was positive but no one else would have been considered exposed, that's unlikely to be made public. However, if there are exposures and there's reason to make the public aware, we will work with the school district to make sure that people have the information that they may need.
And we've talked about it quite a bit in these press conferences over the last month or more about our contact tracing protocols and systems. Obviously, in a controlled environment like this, those contacts and those interviews are a lot easier to make. It's also something that we're working with the University of Delaware on for similar purposes to identify people who may have been come in contact with somebody who tests positive.
But as of now, there is no plans to have like a running list of schools that have had confirmed cases that would be available to the public?
Not at this time, no.
And then just my last question for the governor. I know there have been reports of the Ohio governor testing positive and then testing negative for the coronavirus. I'm curious how often you get tested yourself and what kind of test you use.
I was tested, I want to say, once. It was back. My son has been working remotely and living with us. He works for a computer science company who actually does work in the healthcare space in Cambridge, Massachusetts, but they've been all working virtually, and so he was home and not feeling well, and so he was tested, as was I, and my test was negative. I believe that's the only time that I've been tested. I did quarantine once as a result of one of the staff who tested positive and just served out the quarantine. Was not necessary to get tested because I did the quarantine instead.
Has any of your other staff members tested positive? Just to follow up on that question.
Not that I'm aware of.
This is from Amy Cherry at WDEL. Can Delaware afford President Trump's unemployment, which appears to require states to pay for 25% of federal unemployment?
Well, Delaware is going to use part of its CARES Act to pay for the unemployment benefits that have already been paid out. And so we, with our own revenues, can't afford that. And we will be taking out a loan from the federal government for our current obligations and payments that we'd have to make going forward. And so this new action, executive order by the president, is very complicated and frankly unnecessary. We ought to have had action by the United States Congress. We thank our congressional delegation for working hard for an agreement there to extend within the current framework those resources and that support. It's important support. It's important. It's support that's necessary for Delaware families that have been unemployed. Delawareans who've been unemployed have to support their families. We talked earlier today about our rental and mortgage assistance programs for just that purpose, to help those who are unemployed, and these benefits are incredibly important as well. And so we would encourage the Congress to act to build on our current system, which is not nearly as complicated as this, but we don't have the resources right now. We're using federal resources for the benefits that are being paid as we speak. It's just an unnecessary and complicated way of addressing a real need for the people of Delaware.
From Mallory Metzner at WRDE, is there a timeline for phase 3 yet, and what would it take to get to that point of reopening?
Yeah, so the phase 3 is an interesting challenge for us. Our major objective, as I said earlier on, is to get as many children back in front of teachers and schools as possible, and we're working on that, and school districts are working on that. Many schools, because of concerns over safety and some of the restrictions, operational restrictions, have chosen to go with fully remote learning. Other districts, like Hip Henlopen, which we highlighted today, have a so-called hybrid model of a mix of remote and in-person instruction. And we want to continue to have that movement from fully remote to a hybrid to fully in-person instruction. And to do that, we have to have conditions on the ground that warrant it. We're almost there, and we're getting there. And so the way to do that is to really lean into the guidance and restrictions on activity that exist. There isn't much that would happen if we went to so-called phase 3, any changes, but it would send a signal to folks that, frankly, is not the right signal to send now, which is we've accomplished our goal to stomp out the virus, and we can go back to normal now. So it's really a question of balancing that messaging out, the need to continue on pace, to wear masks, to social distance, to stomp down the virus and enable us to bring children back to schools and businesses more open so that they can get revenue and survive, put people back to work. So we have two objectives: reinvigorate the economy and bring children back to school. They're connected, and so that's what will guide our decisions with respect to the remaining reopening that has to occur. And most of that is around restaurant capacity and gatherings and places that are at the greatest risk of transmitting the virus in our communities.
From Kate Tabling at Delaware Business Times, doctors across the country are hoping for continued measures and insurance reimbursement for telemedicine options, and Delaware has recently lifted more restrictions on telemedicine with a recent bill that you signed. Since many doctors predict that telemedicine will be here to stay, what long-term measures will you and your administration be looking at in terms of telemedicine, as that bill has a sunset provision of July 1st?
Yeah, so we've talked about telemedicine in Delaware for years, going back to my days as lieutenant governor when I did a lot of work in healthcare, health disparities, and healthcare costs, and small business health insurance, and the rest. But in the context of COVID-19 and this pandemic, with the risk of transmitting the virus, telemedicine has been a godsend. And it's been incredibly important to the delivery of healthcare services and getting patients in front of physicians safely, particularly primary care physicians, to get a prescription to go and get tested or whatever the case may be. And that's why we, through legislation that I signed, put in place with a sunset certain terms for telemedicine practice here in our state. They will be important practices going forward, and we will look at some of the conditions as that need to be addressed in a long-term basis as the sunset approaches in July of next year. We also have to take our lead for Medicare and Medicaid in terms of reimbursement. As an employer, the state will establish fees that will pay for telemedicine, and we need to think about how that will work and how it can create efficiencies in the delivery of healthcare services in our state. And I know it'll be an important way of doing healthcare services in the future, and we look forward to addressing any issues that occur over the next several months.
From Nick Cialino at Delaware Public Media, are many school districts reaching out to the state for guidance in formulating their plans for the fall?
Yeah, so one of the things that we've done, and I asked Dr. Rattay to comment on it as well, back when we were talking about the conditions under which schools would reopen, partially remote and partially in-person instruction, and as we move into the scenario number 2, the yellow scenario, which is kind of a hybrid model. We assigned individual professionals and experts from the Division of Public Health to work with educators, superintendents, instructional experts and leaders in the schools and school districts to develop those plans and really to focus on the operational challenges that teachers and schools encounter with children. And I think that's been really helpful to schools, and it's been a way that we've been able to provide real good advice to that decision making. Dr. Rattay?
Yeah, absolutely. We have received a lot of good feedback. Our public health experts who are working with the districts are very busy, meaning that the districts have been spending time working with them, asking questions. And I, in fact, received from one particular district some really positive feedback about the experience. They're finding it very helpful. So we're really glad to be able to support the districts in that way.
From Sophia Schmidt at Delaware Public Media, the University of Delaware is requiring all students, faculty, and staff to be tested within 14 days of arriving to campus. What is the state doing to prepare for what will likely be a surge in testing demand?
So I'll let AJ handle most of this, but first of all, we're trying to ramp up testing more generally to the public. We talked today about testing all teachers initially before they reopen the schools, and then periodically through the month, as well as testing students and children in our elementary and secondary schools. So that's a big commitment in and of itself. We've got employers, the University of Delaware being chief among them, are bringing students and faculty both back on campus, and they'll be tested there. So we do have big challenges, but we also have seen some innovations in testing technology, and we're taking advantage of some of that. So it'll be a challenge, but I think AJ and his team are up to it.
Only thing I would add is that is why we keep on looking for new labs or new capacity. But it's as we look at the school plan. So, you know, we have to hit all these districts at the right time to make that test effective for that school district as they go back. So it's a, you know, a map and a logistical lift to make sure we're effective. But, you know, the big thing is as we get those dates, you know, the farther in advance we have information from whether it's a school district, an employer, University of Delaware, you know, the better we'll be able to accommodate them. We don't want people to travel, you know, across the county, but we also know that we only could be so many places in one day.
And then the final question's from Sean Green at WDEL. The DIAA voted last week to suspend sports competition until December. Do you support their decision, and do you have any concerns about Delaware high schools not having competition while club sports continue, and that this could create a pay-to-play model in Delaware?
Well, first of all, I know how important athletics is to our students and our young people generally. As a lifelong athlete and somebody who played 3 sports in high school and 2 sports in college, and I know how important it is to motivate young people to do well in school, to go to school in the first place, and to have a fulfilling life. So I know how hard the decision that DIAA made. I appoint a number of the members. Some of the members are appointed to the board by organizations that they represent, be they superintendents, teachers, members of the public. And I know it was a very difficult decision, particularly in light of the fact that many of the high schools, the focus of much of the sports that DIAA regulates, were going in fully remote, meaning not having in-person instruction. And so the idea, there are several ideas that they considered, weren't able to get a consensus around. A lot of that as a result of operational challenges with busing and with practice and all of that. And so I think their decision was based mostly on safety and on the decisions that were being made in states around us. The decision of DIAA was consistent with what we've seen in Pennsylvania, Maryland, and New Jersey, and so in that I think they've made a good decision going forward. I do think that we need to look at youth sports. I'm not sure we're fully comfortable with the way some of the sports tournaments and competitions are being managed, particularly from the perspective of following appropriate public health guidance, and that will be something that we're looking at. I know DIAA, I know the athletic directors, the superintendents, parents, teachers and coaches, and concerned members of the public, and frankly, your governor will be eager and interested in getting our students, our young athletes back on the field, back on the courts, enjoying the sports that are so important to their lives. And very difficult decision for DIAA. And I think in light of the situation in each of the school districts with respect to remote learning, the appropriate decision at this time. So with that, as the final question, again, I want to thank everybody for joining us today, for following the press conference, and most importantly for what you're doing to help us flatten the spread of the curve, reduce the spread of the virus. COVID-19 in our state, it's still here among us, and so we need to be smart. We need to get tested. Even if you're not feeling sick with flu-like symptoms, make sure you continue to wash your hands and use sanitizer. And most importantly, wear a face covering, a mask when you're in public. Avoid large gatherings where people are bunched close together. When you're in a gym or at a youth sports event, be it a Little League game or a Summer League basketball game, make sure you're wearing your mask and keeping within 6 feet of other fans and your ball players. And if we do all these things, then we're going to get to where we want to be and have our children back in school and our businesses back online. Thank you for joining us, and we look forward to seeing you the next time.